part of the issue may be that with so many people being affected, 80% of the population, that as a society, we've kind of just accepted this lower level of health as normal, that it's almost, you accept that you're going to have a headache every day, you're going to be tired, and just kind of put it down to society and the days that we're living in. And, you know, that we don't really know good health, what actually is good health. I mean, you're the healthiest person, you and Gail, the healthiest people I know. And, you know, I didn't kind of realize until then that you could actually just feel really, really good, because everyone you know has an issue. Do you think that that's part of the issue with the treatment of this?
Why don't we go into a little bit of historical data, Olivia? Up until 1900, only 30% of the population at large had a thyroid problem. Today, it is almost 80%. And that is borne out by our 21 years of testing with all of our, you know, hundreds and hundreds of clinics and doctors around the world. And of course, Broda Barn, who's very famous for thyroid, and Terry Hurdog, who's very famous for thyroid, who postulate that it's about 80%, which we have confirmed. So it is growing. Why has it grown, right? Well, doctors evolved up until the 1970s. In fact, when I was a young boy in the 1940s, the doctor used to sit me on his table and tap my leg with a reflex hammer, judge the speed of my reflex, and then he'd ask me some questions. I didn't realize he was asking me the questions. You know, was my thinking slower? Did my mood change easy? Was I tired? I mean, did I have weaker muscles? All these key questions he'd ask me, and he would determine from those questions and from the speed of my reflexes whether I had a thyroid dysfunction or not. I didn't get treated. In fact, I got treated. I could have been treated from the age of 7 onwards if I had that. Then in the mid 1970s, they decided to bring in a thing called TSH, which is a blood test to determine thyroid function. I said earlier, according to Dr. Bayliss, the head of the Endocrinology Society in Europe, that he stated clearly that none of the blood tests were valid. In other words, TSH doesn't determine thyroid function. So the doctors of old knew how to treat thyroid. The modern doctors in medical school are taught, look at the TSH, don't ask symptoms, and treat the patient if the TSH is wrong. That is totally not a valid way to treat a patient. You've got to ask them what the symptoms are. Doctors do not have time to ask the symptoms. Hence, the number of people who are being mistreated, misdiagnosed, or untreated is on the rise. I have patients all the time asking me, you know, my doctor didn't ask me these questions. And I say, well, this is part of old-fashioned doctoring. We are asking you the questions, and you're telling us exactly how you feel, and we're going to address your symptoms.
Yeah. Yeah. And I mean, I can say, you know, off the top of my head, 3 women that I know that have gone through the process of having every single symptom and gone through their life, and your TSH is fine, your TSH is fine. Oh, now you've got Hashimoto's, now you've got Graves. And they're good to diagnose that, but nothing before then. They were just told that, you know, it's all in your head. Or, you know, you get this ultrasound, get this supplement, take this, change this diet, just barely, you know, starve yourself so that you're not gaining weight, all those kinds of things. And so it's just, you know, it's common. And I mean, I know that a lot of people watching this would have had the TSH test. It's a common thing that they'll chuck in there with the general checkups. And so, yeah, it would be interesting for people, I think, watching this to go and look at their symptoms, and then they might have an old blood test and actually reference, all right, it was that normal. You know, most likely it was, if I'm right in saying that. I mean, mine were always correct. They were fine, even though I was bedridden. So.
Yes, the TSH always appear to be normal because it's not what's in your blood, it is what is what the intercellular
Mm.
results are of what you're using, and if you can use it. And that is the big difference. So you end up symptomatic, and there's no way out of it. Now, you just happen to mention Graves and Hashimoto's and hashitoxicosis. These are the autoimmune responses. I mean, you don't have to be Graves or Hashimoto's or hashitoxicosis. It's just because you've been mistreated and misdiagnosed that you end up with these autoimmune diseases. And because it was never, ever picked up early enough.
Yeah. And just to quickly wrap up on that one, and you sent me through a list, and there's over 80 autoimmune conditions that you can have just
Yes.
related to your thyroid. It's just, those are the three that we kind of hear about, but it just goes on and on and on, doesn't it?
Yes, it's called the cascade of autoimmune responses. It goes into your digestion, then into your joints, and just goes on and on and on. Yeah.